You know, Singing River Health System covers so many fields of medicine, and they have several clinics throughout Jackson County that cover those fields. Well, a lot of people don't know that they have 5 primary care clinics throughout Jackson County. We're at one of them today, Highway 57 in Vancleave, talking to Dr. Timothy Ivy. How are you, sir?
I'm doing fine.
Thank you for having us out here today. Give us a little bit, if you would, tell us a little bit about yourself.
I grew up in Mississippi. I was raised in Quitman, a small town about 120 miles north of here.
Yeah.
I graduated from Southern Miss and attended medical school at University Medical Center in Jackson, and I did my internal medicine training there as well.
Now, you are an internal medicine specialist. What is the difference between internal medicine and just a general practitioner?
I am an internist, and a lot of people don't know what that is. They get the term confused with intern. An intern is a doctor in training. An internist is a physician who is trained and specializes in the field of internal medicine. Internal medicine is a specialty that deals with prevention, diagnosis, and treatment of medical illnesses in adults. So basically, I'm an adult specialist.
Okay. Speaking of adults, you know, one of the areas that you work with is treating diabetic patients. Tell us about that.
Majority of my day is dealing with chronic illnesses. Diabetes is a major one. It's estimated that within 15 years, 1/3 of Mississippi's population will be diabetic.
Well, we're ranked #1 in the country for diabetes.
Exactly, and obesity. So
they kind of go hand in hand.
they do. Obesity is definitely a risk factor for diabetes. I see hypertension, a hypertensive patient or a patient with high blood pressure, they're 4 times more likely to have a stroke, 6 times more likely to develop congestive heart failure. Diabetes, I mentioned, the #1 cause of end-stage renal disease requiring dialysis. Hypertension and diabetes both are major risk factors for heart disease. 1 out of 6 deaths in the U.S. is from heart disease. So if I can see a patient, if I can control their blood sugars, control their blood pressure, lower their cholesterol, get them to stop smoking, exercise, lose weight, I can hopefully reduce the risk of developing complications or even early death from these illnesses.
And that's a big problem. And more women too are having problems with, you know, I think like #1 killer is heart problems with women too.
It is with women. They can have atypical symptoms, not necessarily have the crushing chest pain that you read about in textbooks that are indicative of angina or heart disease or a heart attack. But if you look at the population, anyone age 40 or older, if you're a man, you have a 50% chance of developing heart disease, a female, a 30% chance.
That's
so
not
you have
good.
To be, that's
yeah, you have to be good. And again, you work with individual patients, you know, on individual basis as far as, okay, you need to stop doing this, you need to do this more if you want to live longer.
Yes.
Now, this is the time of the year that everybody starts thinking of flu season. So it's time to get your flu shots. And that's something that you strongly recommend for everyone.
Yes, I'm definitely an advocate for flu shots. I've already had my flu shot. I have a wife and 4 children, and each year they get their flu shots as well. So I practice what I preach. Anyone 6 months of age or older, it's recommended to get a flu shot this year. The flu shot's not going to cause the flu. I have patients who are afraid they're going to get the flu. If they get the flu shot, that's not the case. It's about 60 or 80% effective, which is better than 0.
Yes, it is.
Yes.
That's a lot better odds than not having it at all. Matter of fact, now through December 31st, Singing River Health System and the primary care clinics do have a special going on. Matter of fact, you can get a flu shot if you're under the age of 3. You get it's just $19. 4 years and older, they're only $24. So that's really good. So what you need to do, call and make an appointment. The number 497-7470 to make an appointment at one of the clinics to get your flu shot. And again, you mentioned that very, very important for people because you know they think, oh, I never get the flu, I never get sick, I don't need it. But the younger you are and the older that you are, you have an easier chance of contracting it.
Yes, young children, anyone age 65 or older, women who are pregnant, and patients with chronic illnesses. They're definitely at risk.
Now, there's 5 different locations of the primary care clinic, Singing River Health System. What are the age range of patients that you see?
As an internist, 16 years of age or older is what I see.
Now, and what are the different things that you treat? Pretty much anything.
Pretty much anything. Chronic illnesses is what I see the most: high blood pressure, diabetes, high cholesterol, heart disease, arthritis, you name it. I do work in patients with acute illness as well: bronchitis, cough, colds, that sort of thing.
Which is normally what you probably see among younger people.
Yes, that's correct.
They really don't have the problem as far as, I don't know, do you ever see any young people that have high blood pressure, hypertension, stress?
Yes, I do. Yes,
really?
I do. I've had hypertensive patients in their late teens and early 20s.
Wow.
I've had patients have heart
They need to
attacks
calm
in their
down.
early 30s. So you definitely need to get it checked out and treated.
And especially if that is something that runs in the family. If you have a
Yes.
a family history of different things like that, it's really, really good to get it treated, or
Yes,
get
it
it
is.
checked.
It's called a silent killer because a lot of times there's no symptoms until
Right.
it's too late. So you need to come in
Somebody
and get checked.
perfectly healthy.
Yes.
I mean, how often do we read of someone who's perfectly healthy, out running track or exercising, and bam,
Right.
they're gone. So another thing, October, and have just a little bit of time left, is Breast Cancer Awareness Month. But through the end, well, actually through November 21st, Singing River Health System also has a special. You have to you get an appointment and I believe go to the hospital. $80 for a mammogram, and those are important to do.
Yes, yes. Prevention, that's a big part of my practice, and I definitely recommend mammograms in the ladies where it's indicated.
How often do you recommend someone to get and at what age do you recommend them to start getting a physical on a regular basis?
I would recommend at least in their early 20s to come by for a checkup and for a physical, just so that we can check your blood pressure, your weight, your cholesterol levels, and get things treated that need to be.
Because again, as you mentioned, with stress and high blood pressure, you can start at a very early age, especially if it's something that runs in the family.
That's true. A lot of these conditions I can actually help prevent. If I see a patient whose blood pressure is just slightly elevated, doesn't necessarily mean you have to be on the medication. We can put you on an exercise program, weight loss program, and a lot of times that will take care of the problem.
Dr. Timothy Ivey, thank you so much
Thank you.
for your time.
Okay.
There are 5 clinics with Singing River Health System, 5 of the primary care centers. There's one in Hurley on Highway 614, Ocean Springs Clinic on Doctors Drive, Pascagoula Clinic on Denny Avenue, where we are today, the Vancleave Clinic on Highway 57 in Vancleave, and then also on Denny Avenue, Pascagoula in the Walmart. So if you need to see a primary care physician, primary care clinics from Singing River Health System.